Yeah. Dr. Kevin Kavanaugh is a retired physician and is also the founder of an organization called Health Watch USA. Good morning to you, Dr. K.
Good morning, Jack.
We caught you quick, didn't we?
You did, yes, quick and a little off guard, but I'm still bright and chipper Monday, so I'm ready to go.
And statistics are looking better.
Much better. Positivity rate is down 6.78% in Kentucky, which is good. Cases are falling and deaths are falling. Remember what we stated, it's a lagging type of an indicator, so deaths are now going down and everything is going in the right direction. Let's keep it going that way.
How do we do it?
Well, we wear masks, very, very important, and we social distance. And when you talk about wearing masks, that means a well-fitted mask that doesn't have holes between the mask and the face, so you're not breathing out the sides of the mask, but through the front. If it's not a surgical mask or a KN95 or an N95 mask, it should be a tight woven, multiple layer, preferably 3 or more layer cotton mask. And remember, if you wear a mask, you still have to social distance. You need to do both.
What about if you've had both, in the case of the product that requires 2 shots? What if you've had both shots? Does that change anything in terms of how you still need to continue to behave?
I wouldn't right now. I think that there are some concerns you could still become infectious even though you're not showing symptoms of the disease. Those concerns are starting to get mitigated with new data out of Israel that indicates that, well, maybe people aren't as infectious. But the thing that's very concerning, Jack, is the Brazilian and the South African variants, which can evade the vaccine. And I think the jury is still out on that. The vaccine will probably help you from not dying or getting extremely sick and in the hospital, but I don't think it's enough that you can let down your guard. And unfortunately, Jack, we do not have robust genomic testing in the United States that we can really determine what's going on there. What is the prevalence of those strains? We know the strains are here. We have delays in getting the results back and far few tests in order for us to determine whether or not these strains are very prevalent in the United States or not. So in this regard, we're actually kind of flying blind. So it's best to stay on the side of safety and wear a mask. And also, as we've stated before, we are not sure how this new UK virus or even this Brazilian or South African virus, how they are more infectious. And that means we really need to get back to the get-go in the beginning, such as in last March, as far as advisements of staying safe. We want to be very cautious, wear a mask, and let's continue to drive these rates downward.
How about some fantastic news from Pfizer?
Yeah, and this is really good. The vaccine, and this is the Pfizer vaccine, they have almost doubled their production rate. And this includes United States plants, and so we should be seeing the vaccines coming on board very quickly. Remember, the Pfizer vaccine will cover our current variant plus the UK variant, which is the more infectious variant of the two. And they feel it has some activity, maybe even good activity, against the Brazilian and the South African variant.
Well, that's good. I'm glad to hear that. Always a pleasure, sir. Thank you very much.
Okay, thank you very much, Jack.